Motion in the low back is lotion. We have to understand what unique movements and exercises cause you pain, but a very universal, safe starting point when it comes to getting motion in the low back is what I call an active cat-cow. Now, the active cat-cow is a movement that I like to do that combines two types of movements, right? We have the cat-cow movement, exercise, stretch, whatever you want to call it. Then you have flexion and extension, right? If you have degenerative discs, you probably have a lot of tension, tightness, achy, inflammation, things like that you're trying to navigate. And we know that motion can be lotion if applied to the right context, right? So when you're doing this, you have to keep in mind your unique pain profile along with your unique pain threshold. Now, with the active cat-cow, you're gonna start with building on just the lower back. We're gonna start with a few reps of just a traditional cat-cow. Now remember, we're focusing on the lower back. You don't have to worry about doing the entire spine, trying to create some wave effect in your back. We're just focusing on the lower back. Now with the active cat-cow, you're gonna do 1 rep of doing the actual cow part and then 1 rep of doing the cat part. And then we're going to move into extension. As you see, I'm moving my hips towards the ground. I'm going just to the point where I might feel pressure, sensitivity, pain, whatever you're experiencing. And then from there, I'm going to actively move into more of a low back stretch. Now, what I don't want you to do is hang out in this child's pose, stretching the low back type of position. All we're trying to do is find where is our pain threshold with combining these movements. So when you're starting with the cat-cow, you're going to gently tip your pelvis forward, gently tip it back, finding that specific area where you start to feel pressure, sensitivity, sciatica, whatever you're dealing with, and then stopping before that pain actually picks up. As soon as you do the 1 or 2 reps that you start with the cat-cow, again, you're gonna move into the forward extension where you're dropping your hips towards the ground, stopping at the pain point or right before the pain point, and then coming out of it, going into a deep low back stretch. Keep in mind when you're doing the, child's pose position or whatever you want to call it, that deep low back flexion, be very mindful of how much you are protecting and guarding that low back. You might see me going deep, but you might not be able to go that deep because your low back is in kind of a stuck fight or flight response, where going into deep flexion like this may cause more sensitivity. So focus on the movement, break it down one thing at a time, and build from there. I just put the final touches on my free DIY back pain fix quiz. This quiz will tell you in minutes whether or not your back pain is actually fixable without doctors, drugs, or surgery. The best place for you to start is truly understanding whether or not what you're going through is actually fixable outside of the medical model. And most people are, but this quiz will give you results in minutes. Not only that, it'll also give you the best plan of action for you to take based on your results. Go to fitnessforbackpain.com/quiz.